So I would love to hear from a few groups who are comfortable sharing. We won't get to hear from everybody because that could take the rest of our time. But can I see a raise of hand as they're somewhat comfortable reporting out, and I will come bring you a microphone. I would love to just hear 2 or 3 key points that were interesting from your discussion in like a minute or 2. Is anyone willing to share? Oh, I see a table over there. Please.
Hi everyone, my name is Rena. I'm from the University of Michigan Dearborn. So some of the things that we wanted to, learn about for next year is language disparities and then some medical misinformation as well, because of COVID and all the information that we're getting from online and how that plays a role. Also, in regards to the genetics, like how could that play a role in patients over worrying and contacting their physician for things that are not as important as I guess they should be.
Thank you. Appreciate it. Any other group? Oh, right next door. So can we hear.
I am Jenny, and I'm a research subject. One of the things that we were talking about at my table is to kind of address the underrepresented for research, because it's so important that everybody is represented. What about thinking from a marketing standpoint? Like commercials or PR, because when you share your story, whether it's positive or negative, it builds trust in what you're doing. And I think that a lot of groups are not really willing to do research because of maybe the history of it, the reporting of it, and the negative connotations that it has. So I think that it would be incumbent perhaps that you have to start this process of maybe promoting it in a way that everybody is represented. Here's my story, here's our stories, let's share this with the world, so that we need you to be a research person, so that not only maybe you help yourself, but more importantly, you're helping others.
Love it. A campaign of sorts.
Campaign, yep.
Thank you. Jenny, can you have 1 or 2 other groups? Does anyone else want to share?
I feel like our group is dominating.
Aaron, go for it.
Just to piggyback on what Jenny said, our group said not only, involving underrepresented populations is key, but that is circling back to those research participants to say, here's what we found. I think that's why Dr. Valley's pulse ox resonated so much, because it said, your data helped us figure out this major story. And, experience some of us have had is that people will say, I was a participant in that, I don't know what they found, I never heard back. And so 2 things we think participants would make them more willing to participate is 1, telling them what you found, 2, telling them what you're going to do about that fight. It was gendered a lot.
Yeah. Thank you. Appreciate it. I'll say I was part of Table 7. Shout out Table 7. And I'll just share that we had an interesting conversation about, okay, if pulse oximeters don't work for certain type, but what else doesn't work? In a good way, it made us think about what other technologies do not work depending on gender, age, race, etc. And so it made us brainstorm kind of how can we take a look at other items like this.
We were wondering about the aftermath in a couple of ways. So it takes 17 years for the research to bear fruition, and then there will be particular groups of patients, particular events. After that, making sure that the benefit also reaches other groups that may have not been part of the original study. And then another aftermath item that we dealt with was communication. One of us has high blood pressure, and the other one has low blood pressure. So when we hear a message about a new development, then how are we to interpret it for our own personal use? And it seems like precision medicine perhaps could lead to precision communication in some way, although we need another hour to work that out.
Sure, yeah, well, it's a great idea. I love it. Let's hear from one more group, please. I see someone in the back there. Yeah, we're bringing a microphone to you. Thanks, Stephen, for delivering.
Yeah, sorry. As for research projects, wasn't actually, I guess, as individual project, but what you're discussing is if there are stovepipes, even within the University of Michigan, where there's data sets that aren't being incorporated into the precision health system, and therefore you're not really using a holistic approach for the patient evaluations. So I guess hearing something about what's the initiatives inside the university, and not only within the medical department, but as was mentioned before, bringing the engineering department in. Yeah, I mean, sociology, I mean, the holistic approach from the university towards this goal.
Yeah, I love that. Thank you. Appreciate it. Thanks everyone for sharing. We're going to have a really quick coffee break. Don't feel too rushed, but so feel free to take a bathroom break, coffee break, 5 minutes or so, and then we're going to resume. And we have a really interesting panel conversation with some of our Bridges space.